And hello, everyone. Welcome to Daytime Columbus. I'm Robin Haynes. Today, you might notice I got someone over here to my right, but this is Rob Montagny. He's the president and CEO of Licking Memorial Health Systems, and we're going to highlight just a few of the programs that make them such a great community hospital today.
It's great to be back. Great to see you. We have such an outstanding staff, medical staff, employees. We're going to highlight the great work they do. We're going to talk about having a baby. We know that is so special. My wife and I, Lauren, had all three of our children, doing great. And then we're going to talk about heart care. There's so much going on, whether it's shoveling snow, maybe you're trying to get that New Year's resolution. So we're going to talk about heart health.
Yeah, we got a lot coming up today on the show for you. After we talk about both of those, we're actually going to talk about Intel coming to town. And this is going to be huge, obviously, for Licking County, huge for the state of Ohio, as we know. So we'll go through some of the preparations that are being made. And then we always end with 5 fast facts about Licking Memorial Health Systems. Always great to, get to brag about all the wonderful people and programs you have there, Rob.
Only 5?
We only have time for 5. I'm sorry. All right. Every year, amongst those, right, there are 1,000 babies plus born at Licking Memorial Hospital. And as any mom knows, prenatal, postnatal care, those are extremely important.
Well, we have such an outstanding group of obstetrical staff, physicians, nurses, and they do an awesome job. Dr. Janae Davis is a leader of that group, one of the many leaders. And I think one of the things that we do well at Licking Memorial is we really are proactive, and we really do things that maybe a lot of community hospitals don't typically do to serve the needs of the OB patients. So maybe talk about some of those things.
Great. So one of the things that I love about our hospital system is that we implemented recently a program called Centering. I like to think of it as prenatal care on steroids. It's great. So typically for a normal visit, you would come and see your provider, which would be your doctor, your midwife, your nurse practitioner, have a few minutes, do a belly check, ask a few questions, and go about your day. But in Centering program, you have an opportunity to join with people who are also due about the same time you are. So we identify moms maybe all due in October, all due in September, all due in June, and give them the opportunity to have extensive care that covers a myriad of different topics for them. So maybe your visit will be scheduled the same time, but it's in upwards of an hour. We'll discuss nutrition, what can I eat, what should I, how much weight should I gain, anesthesia options, what am I going to do about my pain control. We might even have an anesthesiologist come and speak with you for the hour. And it really gives moms an opportunity to have a bonding relationship with other women going through something that they are going through at the same time. And please be clear, it's not just for first-time moms. We also have some moms who had their babies 7 years apart who maybe forgot a bunch of stuff or just want like a different, community atmosphere. So it empowers moms, and, our goal is to have healthy moms, healthy babies. So it's a great program run by our department. So I think that's
Yeah, and I feel like that does promote kind of that healthy birth outcome, having all of those different benefits to that. And I want to talk about the fact that you are a baby-friendly hospital, and this isn't just given out. This isn't just something that happens to every hospital around the area. So, Dr. Davis, what does that mean for you guys?
So excited about being baby-friendly. Yeah, definitely supported by World Health Organization, UNICEF. It gives organizations, particularly hospitals, an opportunity not just in word to say they support breastfeeding, but also in deed. So it's a collective effort. As soon as moms come to the office, they are given little tidbits of information at all of their visits to talk about what are the benefits of breastfeeding, not just for moms, but for babies. Do we have a reduction in cancer risk? Do we have a reduction in postpartum depression? Do we have a reduction in SIDS? Hey, can my mom lose weight quicker? Hey, how do we reduce stress hormone in the baby? All of these different things, childhood obesity rates, things like that. So we follow little tidbits of information through the pregnancy to empower moms to decide if they do want to breastfeed or not. And be clear, if you decide that that's not the route for you, we're still going to give you all this information. There's no stigma against not breastfeeding, but we want to make sure that we have committed to being very supportive in that. And then when you come to labor and delivery, you have your baby immediately. We do things differently than we did 20 years ago when I had a baby. So immediately we place baby skin to skin on mom's skin or support person so that we can decrease that stress hormone. We don't give them a bath and shoot flashes in their eyes and do all the stuff we used to do. We want within the first hour a mom, whether you have a C-section or a vaginal delivery, to have that opportunity to bond right away with their baby. Sometimes I'll be doing my C-section and a little foot will kick me because the baby's already underneath there they're latched on with mom. It's great. And then on postpartum, same thing. All of our nurses have been trained thoroughly and baby friendly. We have lactation specialists that are there to help. And even after you leave the hospital, maybe it's been a couple days, I'm just feeling a little bit sleepy, I'm not for sure, I'm not for sure, can I come back to postpartum? Absolutely. Have an appointment as a postpartum patient to come back a couple days later so that our specialist can see how is that latch. Is the baby gaining the weight that you need, just to give that extra measure of support. So it's
to be confident in what you're doing. Always
it's
important.
a vulnerable time.
The support is so important.
Yeah.
You know, on another note that we don't love to talk about, but we recognize that there's a lot of substance abuse disorder, and our goal is to get the baby as healthy as possible right after the delivery. So maybe talk about some of the things we do to try and help mothers and then ultimately the baby.
Sure. So thank you for bringing that topic up. It's so dear to me. I think we have been given such a great opportunity as a medical community to now recognize substance misuse disorder as a health condition, not just as a choice. And that gives us an opportunity to reach people in a different way and reach them where they are. So as a community, Licking County has decided to join forces with different organizations to acknowledge that there are barriers to care that people have who are experiencing this disorder as opposed to someone else. It is a really exciting time for a lot of people when they get pregnant. Oh, my mom, oh, my sister, all of my friends are excited. But when you have substance misuse disorder, your barriers to care may be elevated. Maybe you have burned bridges with your family members, and so you don't have help and support that way. Maybe you have mistrust of the healthcare system because of a way you've been treated in the past. Maybe you have had to self-select out of support because you have some other support people who are still involved in different activities that are not beneficial to you. So finding community organizations that can help with transportation, mental health access. In some studies, over 70% of patients who experience substance misuse disorder also have a concomitant mental health disorder with anxiety, depression, bipolar, etc. Those can all be really impactful, so we want to come together to try to address those.
To try to address and support. So it's great to hear that you guys are doing that, addressing that. So many good things happening. So thank you, Dr. Davis.
Thank you so much.
Well, Daytime continues after the break. We have a focus on heart health, an always important topic. So we'll talk about some of the technology and the treatments.
And Intel will be here soon. Licking County is the epicenter. We're going to talk about framework and how that's addressing the Intel progress.
And a note that today's show is sponsored in its entirety by Licking Memorial Health Systems.